Solidarity!
Solidarity! 1, 2, 3, 1 day longer! 1 day stronger! 1 day longer! 1 day stronger! Who's got the power? We got the power!
Stephanie Lumho, Office Associate, Children's Hospital, 12 years.
So Stephanie, there's a strike going on here. When did the strike start?
We started on June 18th, and this is day 8. We are out here striking to keep our contracts. UCSF is illegally doing that. We have our court case tomorrow, federal court in San Francisco tomorrow, and we're hoping that the judge will compel UCSF to go to arbitration.
And it seems like the UC management is spending a lot of money on lawyers.
Yes.
Fighting your right to have representation.
Yes.
Isn't it legal for workers to have their own union if they want it?
Yes, my bargaining group, Business Office Clerical, we democratically voted for NUHW to represent us back in 2017. So they are taking that choice away from us and forcing us into unions that we did not pick. We did not pick them.
So they're basically saying you don't have a right to have the union we want.
Yes, they're saying we don't have a right. As their attorney has put it, UCSF can do whatever they want to do. But we filed a grievance, and we have a grievance process which ends with arbitration, and they've been refusing to do that since March. And this is what our court case is for us, to compel them to go to arbitration, and we want somebody neutral to tell us who is right and who's wrong.
And what would it mean for you if you were forced into these other unions?
Less take-home pay. I'd have to pay for my medical coverage, which is currently free. Children's Hospital has offered that forever for all union members. I will have to pay into my pension. I will then, I may have to go and work in San Francisco. I may be forced to work across the bay and work in San Francisco. I just don't know. I really don't know what's going to happen. But I know for sure financially the impact it'll have.
And why is UC doing this?
I believe UCSF is doing this as a cost-saving measure. They're trying to put the cost of this brand new building, $1.6 billion, on our backs, and, by the way, off of the Alameda taxpayers, backed by Measure C, which was passed back in 2020. And they want to use that money instead of what it's for staffing and training to pay for the building. So that's what I feel that they're wanting to do as a cost savings measure.
And UC is supposed to be nonprofit, but it seems like they're in the competition business with Sutter and other chains. Do you think this has something to do with it, that this really UC has become another, corporate hospital chain?
I believe that they are a big corporation. UC is from top to bottom California, and they are just reaching further and further. And I just see them as emulating what's kind of going on politically, where they can just reach and stomp over everyone, all of the hard workers that make them the money, and just bleed us dry while they, the top, get richer.
And the UC Regents are appointed by the governor, Gavin Newsom. Where is Gavin Newsom on this? Because it seems like they're spending millions of dollars on lawyers fighting the union, fighting your right to have representation by the union you choose.
Gavin Newsom, I believe, supported us, believed in single payer, but I'm not sure where he stands now. We have a lot of elected officials that do support us here in Alameda County, and we appreciate them showing up and giving us the support and showing us that we can fight and we can win.
And when they took over in this merger, did they promise that you would have the rights you have, or the same conditions?
When they took over a decade ago, they promised Children's Hospital Oakland and the Board of Supervisors that the only thing that would change would be the name on the building, and nothing else would change, and we would be able to keep our culture here in Oakland as a community hospital.
And what does that mean, having a community hospital?
We're here to serve the community. We are also a federally funded hospital where we get government funds so that we can serve our children that need us the most in our neonatal follow-up programs, our early intervention services that go out to the public, and serve the parents that need us that aren't able to come to the hospital and receive services.
So this would affect those working class families, black, brown, working class families?
Yes, our grant-funded programs have been decimated. UC doesn't see them as profitable, so We lose employees to attrition, where once they retire or quit, those positions are not available anymore to be filled, which means less services to our community. And I don't know what this means for possible Medicaid cuts either. You know, that's just compounds everything.
I mean, it seems like there's a massive attack on health care with Medicaid. I mean, a lot of people would lose their health care. Medicare Advantage, they're trying to privatize Medicare. Are you concerned about the future of health care for people in this country?
Yes, I am. I've been a supporter of single payer because everyone deserves the right to quality medical health care. It's a right. That's why we're all here, to make sure that our kids get the care that they deserve and they need.
And what can people do who want to support you?
We are out here on the strike line Monday through Fridays at Children's Hospital from 7 to 4:30. Come out to the line. We also have, you know, if you want to bring us some fruits, maybe some water, any kind of donations, we are out here. We also have a GoFundMe page at Children's Hospital Strike Fund for the employees that have been out for 8 days. We don't know how long we will be out here. So those are the ways that you can support.
And there are other unions, UPTE and AFSCME at UC, are facing attacks as well, without a contract. Is there any effort to get a united front of all the unions at UC so they can't pit one group against another group?
We've tried communications. I'm not sure how that's going. I think this is UC's point to pit us against each other. Then that's why I think this is union busting. So we can't collectively work together as a group to kind of take down what UC is trying to do to us.
The idea that you have health care free at Children's Hospital, shouldn't all healthcare workers and all workers have health care free, as they do in Europe and Canada?
Yes, not just healthcare workers, but I do believe as healthcare workers we deserve free healthcare, but so should everyone else. It's a right, we all deserve it, but I mean healthcare workers, absolutely, yeah.
And we spend more in this country than other countries in the world for health care, and yet millions of people without health care. It's the highest cause of bankruptcy in the United States. What does that say about how this system is run for health care?
It is a for-profit business. It is not for the people. I've said this so many times, where our healthcare is actually turned into a business. It is not providing the services. It's providing profits for leadership in the C-suites.
And the CEOs of the UCSF, seems they're making a lot of money. Their profits are going up. Yes. It's very profitable. Who is that profit made from?
Those profits are made off of the workers here in the hospital. You know, they say that UCSF is a great hospital. It's a great building, but we, the people inside the building, is what makes it great. We're the ones that provide the skill, talent, and the services to our community. We are the ones that make the hospital great.
And the solidarity, do you have a lot of solidarity here?
We have tons of solidarity. So we also have Local 39, our stationary engineers, out here on an open-ended strike as well. CNA also did a sympathy strike for us for 5 days. Their strike ended, however, I still see a lot of nurses out here who will not cross the picket line. We also have OPIU, Local 29, who is out here every day picketing. And we also have our community members coming out to support us as well.
So there's a lot of support and solidarity for this.
Absolutely. We can tell that the community loves this hospital, and they're not going to let UC take it down.
So maybe you can introduce yourself.
My name is Alexandra. This is my daughter Athena.
And what's going on, and what do you think about this strike?
From what I was educated about this, is that they are trying to strip them of their union, and they will just get their income decreased, their pay decreased by $10,000 per year.
You think that's wrong?
Absolutely wrong. Their degrees weren't free. Why should they have to work for free?
They work at a hospital. Why do they have to pay to go to a hospital?
Right, absolutely. What I was here during the merger, where they dismantled the physicians and tried to do the same with them, and it's disgusting. And hopefully they get the deal that they're asking for.
The people that are running this institution, UC, it seems like they're high paid. They're getting millions of dollars. They are living high off the hog. What does that say about our healthcare system in this country?
That they don't give a damn about us. They don't care about the lesser income people. They care about lining their pockets, even at the expense of us as well as the children that come here.
What does this hospital do for children?
They actually saved my daughter's life. They have done a multitude of things, such as surgeries and care that our home does not do for children. I'm from Stockton, so there is not a lot of child specialists down there. So, and we were sent up here, and they've done one hell of a good job. So my heart goes out to the nurses, and God bless them all. And
They're saving lives here.
absolutely.
Okay, what's your name?
Alexandra.
Thank you.
Thank you. Athena.
My name's Ruth Crow. I'm a licensed clinical social worker, and I've worked for Children's Hospital Oakland for 23 years. We're out here today because we are really upset about the UCSF Health efforts to union bust. We worked hard to have good contracts with NUHW, and we want those contracts honored. We have an option for a very good health care plan and a very good pension, and UCSF Health is playing in the media that we are welcome to join their fabulous long-term benefits, but I'm here to tell you that that's actually a lie, that actually their health care is not as good as ours, and we worked hard to get this health care. We shouldn't feel ashamed as essential healthcare workers to have a free healthcare option. Actually, they should be thinking carefully about what healthcare they offer to their healthcare workers. We're also here for patient care. We've noticed since the affiliation 10 years ago that community-based programs are shrinking. They're being diminished because UCSF Health does not have these services in San Francisco at the Mission Bay side. These are unique programs that serve our Oakland and East Bay children that are vital. These are high-risk infant programs. These are mental health programs. These are programs for teenagers at risk for human trafficking. These are unique and extremely important, vital programs to the community, and what we're seeing is that UCSF Health is diminishing them. Every time there's a problem with a grant, they eliminate the position. Someone retires, they don't rehire. Someone leaves the program and they don't rehire. And so this, we do not believe is a budget problem. We believe this is a lack of commitment. Our affiliation agreement says that we will maintain a private nonprofit status here. UCSF Health is not buying our hospital. We are not merging. They are simply trying to make us employees so that they can bust our union and save money. And we're saying no.
And the idea that you as a worker don't have the right to decide what union you want to belong into?
Outrageous. Completely outrageous. That's a violation of labor rights. We worked hard. This union has been our union since 2017, and we do not agree that they can just decide our union for us. Absolutely not.
Well, why isn't the state legislature and the governor speaking out about union busting? It sounds like flagrant union busting when they're telling you and all the workers here, you have no right to decide who's going to represent you. Sounds like a classic Trump action of kicking people out of the union they want to and telling them where you're going to go.
I think, unfortunately, there's not a political sort of willingness to fight for unions, and it's really disappointing to see that from Gavin Newsom. It's really unfortunate to see that there's not a will to say that this is unacceptable, and it does feel like it really is a mirror to what's happening on the federal level, to what's happening in the White House. That people can be a bully, they don't have to follow the law. You know, one of the issues that is the crux of the problem is that in our contract it says when we disagree with the employer, we will go to arbitration. And that's all we've asked for, is to go to arbitration. And UCSF Health has refused to go to arbitration. We will have our day in court, that's tomorrow, but that's all we've asked for. But it mirrors and reflects exactly what's going on at the federal level, that you can think that you don't have to follow a legal course of action action that everyone else has followed, that you can disregard a contract and do whatever you want to do. And we say absolutely not. We're going to court.
And thousands of other UC workers at UPT and AFSCME are fighting the same union-busting tactics. They're refusing to meet with them. They're putting restrictive rules on when you can leaflet. They're spending millions of dollars on lawyers fighting you. What would you say to the other thousands and thousands of other UC workers about your fight and the connection of your fight to their struggle as well?
I would say join us. I've looked at what's happening with UPT. I've looked at what UC is trying to do to their current workers. They're trying to take away 3 holidays. They're trying to say that health care for UPT workers should have no maximum of what the worker pays. And I say join us.
So you're asking them to join you in a united front?
Absolutely.
What do you think the demands of UPT and AFSCME should be in light of the fact that you have free health care?
UPT is welcome to join us. I'd recommend that UPT say, you know what, we don't want to pay for health care. We have a right as essential workers. We're going to join NUHW and also ask to have a free health care option.
You have it, they should have it.
We have it. Every essential healthcare worker should have it.
My name is Shaquila.
What are the reasons they give that they're forcing you into another union?
Because they can. There's no reasons. They're just saying they want us to be under one umbrella, but they can't make that choice for us.
It's supposed to be legal for workers to have their own representation to decide what union they're going to be in?
Yes.
They're saying, no, you don't have a choice?
They said we don't have a choice.
Is that democracy?
It's not. It's a hostile takeover.
It's a hostile takeover.
That's it. Yep, that's it. Yeah, that's how I feel. That's it.
That's why you're on strike today?
That's why we're on strike. Yep.
How long have you been a member of the union?
12 years.
It seems like there are a lot of discontent workers here. They're fed up with what's going on with UC.
We're okay. They poked the bear. We were okay. We were okay with them taking over the hospital, putting a name on the hospital, even having their doctors come. But you can't mess with our union. That's where you can't mess with our pension. You can't mess with our take-home pay.
We're out here because of the demands of everything that UCSF wants, and unfortunately the demands are ridiculous. So we're out here with our own demands, and we're saying at this time we really need to come together at the hospital and as people for our community and our patients. And right now they're being ridiculous. They want us to do more work for less pay, less take home. They don't really want to meet any of our demands. They're not coming to the table, and we're tired of it.
What kind of work do you do?
I'm a surgery scheduler currently.
They're trying to force you into another union. What is that about?
So right now they're trying to force us into Teamsters. We're not really given much information about Teamsters. We have no idea who to contact. We have no idea who the rep will be. We have no information. We don't want a new union. We're happy with our union that we're in right now. So this whole just giving us information and expecting us to just go ahead and deal with it it's not acceptable.
So they're telling you what union you should belong to?
They're telling us what union we're going to be in and had given us a date to say, oh, yeah, you're going to be in this union on this date. That's it.
Why the Teamsters?
I believe that's a union that they have at UCSF, but I'm not 100% sure.
So do you think that's democratic?
No, I don't. I don't know if I can say what it actually is, but I don't think it's democratic.
Sounds like union busting or taking away your democratic rights.
It's taking away all of our rights. It's definitely giving a dictatorship vibe.
And also, if you go into this other union, what would happen to your wages, your benefits, and your conditions?
So a lot of employees have already started to lose income if we do the merge. They told us that we would actually get the same amount of pay, but it's actually not true. When they started sending out offer letters, the pay was different for some employees. So
they lied to you?
Yes. In short, yes. I didn't want to say that, but yes, they did lie to us.
Phyllis Stanley, one of the medical social workers here at Children's Hospital Oakland.
And there's a strike going on. What's going on and why are you on strike and your fellow social workers?
Yeah, there is a strike going on, and we are standing in solidarity with all the staff who are on strike, where we're supporting the major impacts that this particular quote-unquote integration is happening on all of our staff here, where they are making us pay for benefits, which we are not paying right now under the Children's Hospital model. They're not increasing our wages to offset that, which then is causing some staff to have to take on potentially additional jobs to be able to cover their basic needs, also to be able to just afford cost of living, some even having to leave the institution, which isn't okay. Also too, just we have a lot of positions open, which aren't being filled, which is also driving patient care over to the Mission Bay side, and so there's an issue. So us as social workers are standing in solidarity with our staff who, need support. We need support because we're all being impacted across the board, and want to make sure that UCSF hears that and can show some heart and being able to consider how their great staff is being impacted so that they can be able to support us as we support our community.
And you don't pay for health care. The other social workers at UCSF in San Francisco are paying for health care. How does that fit? Why is it that you don't pay for health care and they're paying for health care?
Well, that's our children's hospital model. They're taking care of our staff who are taking care of our children. And UCSF's model, they said we provide great benefits, but I guess it's at a cost. So this is where they're trying to force us into that model. We, of course, respect our colleagues across the Bay, and it's unfortunate that that's the model they've had to live under, and we're being forced to have to live under that model as well, potentially.
And they're without a contract as well, UPTE and AFSCME. Both are without a contract. The university is spending millions of dollars on lawyers fighting them. Shouldn't you have the right to have your own union that you choose?
Absolutely. This is where we fought to have this union because this has not been a union that's been historically here, and so we've really fought to bring this union in, who supported us to be able to get the rights and benefits that are supporting us in the work that we're doing, and so we should be able to keep that as we transition into quote-unquote being UCSF employees.
And California is a Democratic state, Democratic legislator, Democratic governor. Since apparently they're union busting, they're taking away your right to have your own union. Shouldn't the legislature start to have hearings on what's going on? Because it seems like they're spending a lot of money, our money, state money, on taking away your democratic rights.
Absolutely. I think it's about equity, it's about fairness, it's about heart and compassion and sympathy, and so that's what is at stake in justice. And so I think that definitely should be brought up and that should be considered and looked at.
And the stress of a pay cut, having to live in Northern California with the cost of housing and everything else, is that going to affect care?
Absolutely. Because it's going to be where staff is not going to be able to afford to stay to provide care to patients and families. They'll have to go to other institutions that are paying more and being able to support with the benefits. Therefore, if there's not staffing, patients and families aren't getting the care they need. That means we're shifting care away from here, and it's going to be stripping the hospital and the core of this hospital.
And the Trump government is attacking unions. They attack federal employees, took away their union rights. You think this is part of the attack on workers that's going on in this country?
I don't know if this is their intention, but it definitely feels like it kind of aligns with it. So, I just hope, again, that they're able to really see how this is impacting us and having some compassion, say if we really want to take care and we actually care for our staff that's providing care, that we will be able to lean in and support in the ways of what we're saying.
Okay, thank you.
We're here to save our union from getting taken over by UCSF.
Why do they want to do that?
They want to do that? I don't know why they want to do that. Maybe more power, I guess. Yeah. So that's mine. That's my take on it.
Is the Union 39 supporting the strike?
What?
Is the 39 supporting the strike?
Yes, yes, we are.
Why are they trying to take away your contract, your union contract?
We don't know why. It's each different section has a different take on it, and ours is that we're just getting booted out of Local 39 to a new union. Yeah, which we don't think is right.
Well, at UC San Francisco, there are 39 members there at UCSF.
But that's for engineering. At Oakland, it's biomed and engineering. So we're part of biomed. Biomed's getting kicked out and have to switch over to AFSCME.
And AFSCME, do they have the same benefits you have?
No, they don't. Their benefits are a lot less, and as a matter of fact, they don't even have a contract right now. They're out of contract right now as well. So, and their pay is not as lucrative as ours. So, our pay is much better.
Isn't it the right to have your own representation as a union? Don't you have the right to have your own union if you want another union?
We already found legal, laws in the California law that each campus can have their own union, and they're not giving us the option to have our own union.
So they're taking away your right.
Pretty much, yes. They're taking away our right to choose our union. They're forcing us to join another union.
And who are the Regents, and why are they spending so much money fighting you? I mean, it seems like they've got a lot of money for lawyers.
Oh yeah, definitely. Well, and they want to combine, because if they can combine everyone to a medical center, then they can just have everyone go from Oakland over there without having to pay extra when you have to report to a different site. Doesn't matter if it's further for you. They just want to be able to move you whenever they want without having to pay for it.
They say they're competing with other hospital chains. They got to be competitive. This whole idea of competitive corporate hospital chains, it's supposed to be a nonprofit, UC.
Well, if you want to be competitive, pay good wages to your employees. And that's how you get better employees, paying better wages. That's how you be competitive.
And how long have you been at Biomed?
I've been a Biomed for over, 26 years. I've been at Children's Hospital Oakland for 16 years.
Like the work?
Yeah, I love my job. Yeah, we love maintaining the medical equipment for the children, making sure everything is safe and calibrated for them.
Why you have to go to court to get your right to representation?
We have to go to court because we have a contract that they're violating. We have a contract that says that if the hospital gets sold, gets acquired by anybody else, we have to go to arbitration. And UCSF totally skip arbitration. They refuse to go to arbitration. So we file a lawsuit in San Francisco to force them to go to arbitration and get an injunction on all this merger.
And they're saying that you don't have a right to decide what union is going to represent you?
We built this union from the bottom. 15 years ago, we built this union from the bottom. We chose this union. And in the state of California, we have the right to choose our own union. And now UC is saying, no, we're going to terminate your union and we're going to fix you up with whatever is comparable with you.
Is that union busting?
Yes, it is. Totally. Yeah. And we got to stop the union busting because it's disgusting.
And some of your members don't have to pay for health care?
We don't pay, healthcare workers here in Oakland, we don't pay for healthcare. And over there, they're making us pay almost $500 for our healthcare, and they are also making us pay our own retirement, 9% mandatory, 9% retirement, and we don't pay here. Whoever that wants to contribute for 403B, we contribute or our own will, but we're not forced to pay for our own retirement. Over there, we are going to be forced, and we're going to be forced to pay for our own healthcare, so it's pretty much like 15% pay cut on what we already made. And this is our hospital. It's been our hospital. I worked here for 10 years. It's been my hospital for 10 years, and it's a community hospital. We don't want to privatize it like San Francisco does with UC Health over there.
How have they privatized it? What does that mean?
Well, they're trying to privatize it. They try to make it more profits than patients, and we care more about patients than profits.
And I thought they're supposed to be a nonprofit for the people.
It's supposed to be, but that's what we thought. We thought that this hospital cannot be merged with UC because it's a federally qualified hospital, but apparently UC said that they can do it, and they're going to do it whether we like it or not.
And they're spending a lot of money on lawyers, UC, management, the Regents, millions of dollars. Why is that happening? I mean, it seems like that money should go for the workers, the patients.
But if you think about it, they're gonna be saving almost $10,000 each employee. We're $1,300, so that's about $30 million that they're gonna get in their pockets every year. Long run, they're gonna make more if we let them merge us with them. But no, we're fighting for a hospital. This hospital has been here over 100 years, and we're gonna keep it for Oakland. This is our hospital, it's our union. We're not gonna allow them to take our hospital and our union away from us.
Isn't this a basic worker right, human right?
Yes, it is. And the state of California, even the governor said, we have the right to choose our own union. They cannot dictate what we're gonna do. And that's what they're doing, And the thing is that this started in 2013. Why now? Why now? Because Trump likes to be busting unions, and they think the judge is gonna be on their side. Because that's what happened. Because if you really think about it, why wait 15 years to do it?
You think they're taking a lead from Trump?
Yes, they're pretty much doing whatever, because that's what they told us at every bargaining meeting. They said, this is happening whether you like it or not, and there's nothing you can do to stop it. That's UC words.
Is that a dictatorship?
Yes, it is, and we're not gonna allow that. No kings, right? No kings. So, and also, UC said on the news that, oh no, we're gonna be put up with better unions and better healthcare. We're gonna get the same as San Francisco gets. No, San Francisco don't know what good is. We have a good union, a good contract. And they said we're gonna get fixed with somebody else. No, if I want to get a job at San Francisco, I will apply there, and I have the unions they have. But if we're here in Oakland and we have our own union, they have no right to take our union away from us, and we're not gonna let them.
And AFSCME and UPTE unions at UC are fighting for a contract. They're without a contract. Well, what's going on there?
Well, they don't even have contract for their own people. Can you imagine us? What happens over there, they have like 10 different unions because that's how they separate employees. Us here, we have the same union for the professionals, for the techs, and for the business clerical. That's what makes us strong, because we're together. And what they try to do is separate us. Here you go, there you go there. That's how you kill people's power.
So they're pitting worker against worker.
Yes. Right now, we have the power as workers because we are united, and we're not gonna get divided. This is why we're fighting, to keep our hospital, to keep our patients, and to do patient care instead of profits. Before, when we were just Oakland, we cared about patient ratio. Make sure there's enough nurses for as many patients are we having. Right now, all they do is numbers. Numbers and numbers. Oh, you didn't meet the ratio of the numbers. That's why we can't get you no help. That's why you're gonna get short staffed, because all they care is about money. Building new buildings where all the administrative people can be there. But no, it's about patients. Measure C, we passed Measure C 4 years ago. That's $30 million guaranteed for Oakland Hospital for 20 years. There's $100 million now that San Francisco tried to steal. They steal $30 million to build that building there. And you know, this supervisor came yesterday and talked to us, Nate, his name is. He made them return it back to our account, because that's a special tax that Alameda workers get for hospitals, Head Start programs, and daycare. And they tried to steal it. San Francisco tried to steal it, and he made it happen. He sent it back to us.
You think they're corrupt?
Yes, they're trying to take our money. That's Alameda money. It's a tax that employees from Alameda pay. Why do you want to take it to UC? They want to pull the strings. But you know what? Since I was little, my mom said, do not take what doesn't belong to you. So that's what you see. Don't take what doesn't belong to you. That money, Measure C money, is for Oakland. Community hospitals, Health Start programs, and childcare. Oakland employees pay it. Why do you want to take it? It's not yours.
And the regents are appointed by the governor, Brown, and now Governor Newsom. Includes the Tony Thurmond, the Department of Education director. Where are these people? Have they stood up and said, stop the union busting? It seems like it's straight out union busting to say that they're going to put you in the union that they want you in.
We have gone to a couple of meetings with the regents to kind of like, express our case. They said they were with us. They support our case.
Have they publicly challenged
the head? They haven't publicly done anything. They said they're with us, but they haven't publicly. Everyone is afraid of the justice system, because they know the justice system is corrupt in some ways. They want to do whatever they want to do, and nobody stops them. They got a little of a break because they haven't done this, but now that Trump is giving them a lot of leeway, because Trump hates unions.
He wants to get rid of all the unions.
He's trying to get away all the unions. This is why they feel strong enough to do the support, because Nicholas Holmes signed our contract. And on that contract that he put his signature on, it says we're going to go to arbitration if anything was to change. And now they totally skipped that. So why? Because he feels strong enough that this is going to happen. But tomorrow, we have a court at 1 p.m. in San Francisco, and 50 of us are going to show up there to show our support, because we're the grievance. It's like a divorce, mom and dad, and who's going to keep the children? No, the children are going to stay with Oakland. We support our children. We take care of the children as if it's our own family. Not UC. UC is just numbers. Come on, in and out. Get rid of them, No.
Who should run the UC? It was under the state of California. You think that the people should run it, but it seems like the people aren't running UC now.
No, you know what? I think they forget. Supposedly Nicholas Holmes says that he started from the bottom, but he forgot what it is, because he lives in a condo that is $2 million for free, a UC condo in San Francisco, and he gets $2 million a year. And he forgets about the little people that barely makes $30 an hour and that are here striking for our rights.
The other unions, do you think that they should join with you? Because it seems the other unions workers should have free health care as well, the same thing that you have.
Yes, we want them to have the same benefits, but the problem over there is that UC created 10 different unions, so they don't have enough support. Us, we got support because we have 3 different bargaining unions, and we all get united. Plus, we have CNAs and engineers. You know, if every single union in this hospital says something's wrong, that means something is definitely
Maybe
wrong.
they should make the same demands that you have in your contract. So you have, if they made the same demands you have here at Children's Hospital, it would benefit them tremendously. Wouldn't it help their members?
It will help everyone. You know what? A healthcare employee should have free healthcare. Because, you know, we work for you kids, so they should protect us. We need to get taken care of so we can take care of the kids. We don't ask for the whole families, we ask for us. Us as employees should have free healthcare if we are healthcare workers.
If they can do it for you, they should do it for all
They should do it for you, yeah, for San Francisco, for everyone, you know?
And what can people do who want to support you?
They can write to Nicholas Holmes, nicholas.holmes@ucsf.edu, and tell them that union busting is disgusting.
She has a wealth of information about everything going on in this city. Everybody, Clarissa!
Good afternoon. Good afternoon. Thank you all for everything that you're doing. My name is Clarissa Douthard. I'm going to just say 2 words. One, thank you so much for being out here. It is not easy. It is not easy to sit here and march. It's not easy to take time off of work. And all of the parents in our organization are absolutely cheering you on. We depend on you. We rely on you. Children's Hospital, I'll just say personally for me, Children's Hospital was an absolute lifesaver. My son suffers from moderate to severe asthma, and he also is neurodivergent and has special needs. Children's Hospital was a home for us, a family for us. Y'all took care of us. You take care of Oakland. Your labor takes care of Oakland. You do not deserve union busting. You don't deserve to be, taken over by some kind of corporate board. You deserve every penny of those Measure C dollars that we all voted for. We support healthcare, patients over profits, and please stay out here and hold strong. We're gonna be out here with you. We're gonna be out here with you the whole way. Because we know that families and workers united actually make the change we want to see. Thank you so much.
All right, next we have from CNA, Lisa.
Thank you, everyone. I can't tell you, I've been out here every day, and it's just been so gratifying and so joyful to see all of us here together, because we all know what it takes to take care of our patients. All of us out here are the ones that normally take care of our patients. And that's what's made this hospital so unique and so special. And that's why we're out here, is to fight to keep it that special hospital for the kids. And if we're not taken care of as the workers, we can't sustain ourselves to take care of them. We're patients too, right? So I'm proud of everyone. It's scary, it's worrisome, but everyone's being so brave for the right reason. And what's great is that as we continue to fight, we continue to win. CNA, the nurses union here, filed charges against UCSF. Charges for violating our contract and for taking away our contract. And we know that we're going to win that, and we learned that the Public Employee Relations Board sides with us. They agree with us. They respect our charges because they know what UCSF is doing is wrong. So union power all the way, solidarity all the way. We stay out here, keep fighting.
My name is Willie Williams.
And what kind of work do you do here, Willie?
I'm an elite orthopedic technician, orthopedic department, been here for 15 years.
And what are the conditions that led you to go on strike here? What happened?
Well, the conditions first and foremost, I could talk about the economic impact on on one of us that's standing out here, but what's really important is the level of care that our children deserve here at Children's Hospital. We're a level 1 pediatric trauma center. The people that you see here today are trained professionals to deal with children. And that's what our children in our neighborhood deserve.
So this is a people issue.
Yes.
And what do you think the purpose of UC management is? Why are they trying to basically bust your union and cut your wages and,
They've already said this is a cost-cutting measure. However, it's not cost-saving for us because all these members are going to lose a minimum of $10,000 difference in their paycheck a year because at this establishment, our employer puts into our pension. We can voluntarily put into our pension, and we do. Our employer also pays for our health insurance. On the other side, they're going to take 9% out of our paychecks and also have us contribute to our health care. And again, I want to emphasize, that's just a portion of it. The most important part is the health care and the quality of care for the children. The money is just another element.
Why are the other UC workers not joining you? Because it seems what you're fighting for would benefit them.
It would seem that way, but if we join a different union, that other union just gets more union dues.
Have the other unions come out in support of you?
I can't speak on that, to be honest with you. I don't know.
Have they been out here from AFSCME or UPTI?
UPTI has been out here, yes.
Because it seems like they're fighting union busting as well, with the lawyers attacking them.
We've had several different unions come to and support us. I can't tell you exactly which one, but I want to tell you right off, I am grateful for every single union that came out here to support us.
And do you have support from the community?
Absolutely. You hear the horns? You hear the horns? You hear them, they're blowing horns all over the place. I would just explain to you, one reason why we want to keep our union is because we have a very strong union. We have a great contract. And the reason why we had this contract is because we fight. UCSF just does not give us anything. We have to fight. My last day of bargaining that we went to in the last few years, we were there for 21 hours or so, fighting for what is right. And this is what we're fighting for. We're fighting for patients' right, we're fighting for union members' right, we're fighting for our community.